You've been talking to families on the front lines of this crisis for years and years. Were you surprised by the numbers from last year?
I'm sorry to say that I was not surprised, and that's because I've been talking to families and professionals for the past year, Steph, and during COVID, they've been saying to me, things are getting worse, for a number of different reasons. People were isolated, obviously, like all of us. If you're someone struggling with substance abuse and you're isolated and you're separated from your support system, you can't go to, those 12-step meetings that you've been going to for sobriety, et cetera. It's a really, really difficult time. And couple that with the increase of fentanyl on the streets right now. I was with the DEA a couple of months ago here in New York, looking in their lab at the amount of fentanyl that they're seizing. It's astronomical. So the supply of drugs is up. And then you've got people really struggling during the pandemic, and that equals a perfect storm.
Doctor, overdose deaths were already on the rise before the pandemic. So what else is driving these numbers so high?
Well, certainly it's the pandemic, but I think it's twofold with respect to the pandemic. One, it's the emotional element of seeing friends and family members in the ICU, hospitalized, and even die. Two, it's the economic hardships related to the pandemic. I mean, we've seen a lot of people underemployed and unemployed. So couple those together, there's been a huge reduction in coping skills, and that's led many to use these mind and mood altering substances that we're talking about, specifically synthetic fentanyl, which is so devastating.
So, Doctor, obviously to say what's the solution is sort of ridiculous. If we had a magic potion, we'd use it. But what can we do right now in the face of this crisis, practically speaking?
Sure. I think that there are a couple things we can do. One is we need greater availability of naloxone. Naloxone is also known as Narcan. It's the opioid reversal agent. It saves lives, no question about it. You just have to spritz it into your nose or have someone else do that if you're overdosing. We're seeing more of that dispensed now. Pharmacists can dispense it without a prescription. I think we need to see more of that available in rural areas of the country, too. And then two, we have greater access to telemental health services than ever before. Certainly before the pandemic. This is extremely helpful to access counselors and therapists and psychiatrists for people in need. Get them into recovery services, get them the treatment they need as well.
Kate, you report on this every day. What do you want people to understand?
I think also just getting the word out, Steph, about fentanyl in particular and how dangerous it can be, because some of the families that I've talked to believe that their young people in their lives died after taking fentanyl, not realizing that they were even taking it. It's in pill form now. It's in counterfeit pills that dealers are pushing as other things like painkillers, and you don't even know that you're getting fentanyl. So part of it is raising awareness about the dangers. For at least for one population. And as the doctor said, also raising awareness about how to get help and talking about substance abuse and where people can find those resources. Because, again, for months, we've been so focused on COVID, I think that maybe we as a public haven't really focused on those who need help with substance abuse.